Hello, everybody. Today we have a class of cholinergic pharmacology related and the continuation of the previous chapter. Okay, so let me turn on my camera too, and we are starting. Okay, cholinergic pharmacology. Let's say hello for all the students of Eurasian International Medical University now, and we are starting here now. Today we are going to continue with the same chapter. We have already learned about the classification of the cholinergic receptors too, and where they are located, what type of changes are there are being performed when they are activated too. We have already learned them. We have already learned some agonists and too. Okay, we'll be repeating about a little bit of them too. And so let's start. Okay, here we have now initially. Let's continue here. Now, we have already talked about the classification. M stands for the muscarinic ones, and N stands for the nicotinic ones. Now, these are the agonist types. The most important agonists are in here. Now, acetylcholine, the definition of acetylcholine and its effects, but it's not mainly used in the clinic as clinically, or in medicine. It's not used. We have already talked about them too. Anticholinesterase drugs, these are drugs that inhibit the activity of the enzyme of acetylcholinesterase. Okay, now, and then there are reversible ones and irreversible ones. We have they change according to their duration of action, 2 to 10 hours, the reversible ones. But what about the irreversible ones? About 2 weeks. Okay, there will be, and there are even substances that actually prevent. Now that actually what they convert the bound substance, that they convert the inhibitor substance back to its normal state. Okay, so inhibitor substance are being broken down. We will be talking about them too after some time. It is called as aging. Okay, aging of that substance. If the aging will be occurring, it will not be able to be converted. But if the aging does not occur, for example, if you have then now the drug has been taken, and if people do what put another substance that will prevent the aging, it will be what now it will not be becoming as irreversible substance, and acetylcholinesterase will be functioning in that way. Okay. Now the proserine and the drug proserine effects too. Here we have toxicity. Here is also considered too. Now and here we have an irreversible type of action. Okay, cholinomimetics. We have talked about it. Then now this aceclidine pilocarpine. Actually, pilocarpine is the substance now, and this is used for mainly for glaucoma treatment, for the meiosis, okay, and also for the decreasing of intraocular pressure too. Okay, what is the meiosis condition where with what restricted to pupil. Okay, and here aceclidine has also similar effects too. Pilocarpine and aceclidine. Now these are the agonists too. So let's come to our main parts. Okay, muscarinic agonists. Now, muscarinic agonists mostly they do have what type of endings? They have they have suffix inside of it. Okay, so now, for example, ACH is acetylcholine, as you know, and it will be activating both muscarinic and nicotinic receptors. But it has it will be activating both of them, and this is actually a negative sign. Now, if we want to activate, let's say, only muscarinic receptors, we will not be able to use this acetylcholine. And here we have what, and it has also very short half-life, and it's not used clinically too. Now, if you will take orally, it will be easily broken down too. Okay, even if you take intravenously too, it will be also broken down too. Okay, bethanechol. Now, bethanechol is actually used for what? This is the muscarinic agonist. Bethanechol used for what? For the treatment of ileus and urinary retention. Okay, B actually coming from what? Now, here we have B. B is also used for the what? Urinary retention for the bladder. Okay, and now you can memorize this way. Bethanechol starts from B, so it is used for the treatment of bladder condition of urinary retention. Okay, and also bowels too. Okay, what is the bowels? Now, in postoperative neurogenic conditions too, it is used for the treatment of ileus too. Okay, or ileus. And now, bowels, actually another name for the bowels is the intestine. You should know about it too. Okay. Now we are continuing here. Methacholine. Methacholine is mostly selective. These are all actually now selective ones, bethanechol, methacholine, and pilocarpine ones. But selective only for muscarinic ones are these ones. Okay. But what about acetylcholine? It is non-selective agonist. Okay. So methacholine is used for treatment of bronchial hyperreactivity. And pilocarpine, we have already talked about the pilocarpine, used for the xerostomia and glaucoma too. Okay. Sjogren is autoimmune disease is the lymphocytic infiltration of the lacrimal and salivary glands too. It affects female and age of between 35 to 45. Okay. Now, here we have another acetylcholinesterase agonists too. Okay, these are the now reversible ones, and most of them are reversible ones. But the last one here we have organophosphates. These are the irreversible ones. Okay. Now, initially, all of these, if you see any name for the stigmine, let's say, most of them have this type of endings. Okay, stigmine ending, and here when we see this type of stigmines, we can conclude that they belong to the class of acetylcholinesterase inhibitors. Okay, now acetylcholinesterase agonists too, edrophonium, for example. Now another one, short-acting edrophonium is the short-acting one, and this is used for the treatment of myasthenia. Now, myasthenia, there are two types of myasthenia actually. Let's talk about them too. Okay, myasthenia, Lambert-Eaton myasthenic syndrome. Maybe you have heard about it too. And there is also the condition with myasthenia gravis. Okay, you should. I think you are aware of them too. Myasthenia gravis. Now let's compare them. Lambert-Eaton myasthenic syndrome is related with weak leg muscles. Okay, but about the myasthenia gravis, it will be related with eyes, the muscles of eyes, face, and also swallowing. And they will be having difficulty in swallowing too. Another one, weak arms, also will be what observed in this type of patients when they have what? Myasthenia gravis. Now, what about the exercise? Let's say people with Lambert-Eaton syndrome, Lambert-Eaton myasthenic syndrome have what? Have done some exercise. What do? They will become better. Okay, their weakness will not be felt anymore. But what about in the myasthenia gravis? If they do some exercise, they will be continuing to feel exhausted. they will be feeling tired, even if they do exercise too. Okay, this is actually related with the condition of calcium. Okay, now in the first one, in Lambert-Eaton myasthenic syndrome, it is related with the calcium flowing. Okay, calcium channel related with calcium channels. There will be an accumulation of calcium occurring. But what about the myasthenia gravis? In the myasthenia gravis, it is related with now neuromuscular junction and two. Okay, neuromuscular junctions, and the muscles will be what the muscles are going to be activated in that way. Okay, contracted in that way. So let's move on here. What about this physostigmine? This is the tertiary amine. Now, tertiary amines actually can enter the central nervous system. Okay, central nervous system. So another one, it is used for the glaucoma antidote in atropine overdose. Now, atropine is actually the antagonist of an antagonist of cholinergic receptors. Okay, so used in many different areas. We'll be talking about it after some time. Okay, so neostigmine and pyridostigmine, and these are the quaternary amines. There is no entry for central nervous system, but and used we have talked about it. Now, ileus, urinary retention, myasthenia, reversal of non-depolarizing and M blockers. Okay, and nicotine, neuromuscular junction now and blockers. Okay, and now and nicotinic and muscarinic blockers. I'm sorry here. And what about the donepezil and rivastigmine? Donepezil and rivastigmine, these are used for the Alzheimer's disease treatment. And these are the lipid soluble. It can easily enter the central nervous system. And about the Alzheimer's disease, it is the disease, as we know, and is with the memory loss, and cognition is also lowered in that case too. Okay, cognitive decline will be occurring. And now, in actually acetyl, now Alzheimer's diseases related with the loss of acetylcholine neurons in Maynard's nucleus. Okay, Maynard's nucleus, and this is found in the part of the brain too. Okay, now what about the organophosphates here? And now organophosphates are the irreversibly binding inhibitors. Okay, they are the lipid soluble ones, and these organophosphates can be actually very fatal too. Okay, now for example, insecticides are used as organophosphates. Now insecticides belong to the class of organophosphates. Another one, sarin gas, nerve gases, and they are also included in this class, organophosphate classes. Sarin gas is actually a nerve gas. Okay, this is the gas which was used in Syria. Okay, as a chemical weapon. I think you may have heard about it too. Okay, so another one used as insecticides, we have talked about it. In these insecticides, what type of insecticides are in there? These are the malathion and parathion. Okay, and nerve gas, and we have talked about the sarin gas. Now, clinical correlate Alzheimer's disease. Now we have talked about the properties of them. It is related with the loss of acetylcholine neurons in Meynard's nucleus. Okay, rationale for clinical use of acetylcholinesterase inhibitors. Characteristics of ganglion blocking agents. Okay, what type of characteristics do they have? Is actually now these are the antagonists. Now we have passed through the antagonist parts, and here we have an effect of ganglion blockade. And if the ganglion will be blocked in there, For example, there are two types of nervous systems, autonomic nervous systems, as we know. The dominant system will be what? The dominant system in here, in all of these parts, mainly these are the parasympathetic nervous autonomic nervous system, okay? PANS, okay? In some parts you may find out it as PSANS or PSNS, because of parasympathetic, okay? Parasympathetic, most of cases. And now parasympathetic nervous system and sympathetic nervous system, both of them have their own their own receptors in these organs, okay, in these parts of our body. For example, arterioles also have SANS receptors 2 and PANS receptors 2. Heart also has, but mostly which one will be dominating? Dominant system will be used as parasympathetic nervous system, okay? For example, heart is dominant. Dominant in parasympathetic. In the eye, it's also used. It is used as what? Parasympathetic is dominant too. This condition is also used in the eye. Cycloplegia, and the ciliary muscle will be damaged. The condition of damage of ciliary muscle is cycloplegia. Okay. Another one in the GI tract, and it's parasympathetic is also dominant in the bladder too, in the salivary glands too, but only in the blood vessels and sweat glands. The sympathetic nervous system is dominant only in these cases. Okay. But what will be when there will be a ganglion blockade? The ganglion blockade will be occurring as the opposite of what? Opposite of the nervous system. Okay, what type of nervous system? Arterioles, for example. Sympathetic nervous system is the dominant. Okay, sympathetic nervous system results in what? It will be resulting in vasoconstriction. What is the vasoconstriction's opposite of it? Vasodilation is the opposite of vasoconstriction, okay? And in here too, veins and vasoconstriction will be in here, but vasodilation will be the opposite of it, which will be the effect of ganglion blockade, okay? Another one, heart parasympathetic nervous system will be what? Will be it will be resulting in the in bradycardia. Actually, what is the opposite of bradycardia? This is the tachycardia. Okay, you should know about it too. About the iris, what happens in the eye? In the eye will be constriction will be occurring. Okay, and the pupil constriction will be occurring. What is the opposite of the constriction? And this is the mydriasis and dilation of pupils. Okay, this is the condition of dilation of pupils. And another one, cycloplegia 2. Now, another one, GI tract. And GI tract, it will be decreasing the tone and motility. But what would happen if the parasympathetic nervous system is activated in the GI tract? It will be increasing the GI motility, actually, which will not result in constipation. It will be resulting in diarrhea, okay? And the opposite of constipation is diarrhea. Now, bladder, here we have in the bladder, related with the bladder, urinary retention will be occurring, which is the opposite of parasympathetic nervous system. Salivary glands would result in what? Actually, when we activate parasympathetic nervous system in salivary glands, it will result in the increased production of saliva. But in here, what do we have? The opposite of the increased production of saliva is xerostomia. Okay. And sweat glands, here we have the opposite of sympathetic nervous system. This is the anhidrosis, okay? Now, let's come to the antagonist of atropine, okay? Atropine is the prototype of the class, actually. As a tertiary amine, it enters the central nervous system too, okay? Other M blockers differ mainly in their pharmacokinetic properties. Belladonna alkaloid. What's the belladonna? Now, early people were using this term as belladonna is actually a beautiful woman. Okay, it means beautiful woman. Okay, they were thinking that if the woman has dilated pupil, it will be looking beautiful. But if now, for example, if we see big pupil, big pupil woman, what can we say? We can say that this woman is actually taking drugs. We could conclude it in this way, okay? But early people were thinking that this type of women are beautiful ones. Now, it will be resulting in big pupil, okay? The opposite of what? Constriction of eye, constriction of pupil with mydriasis. Mydriasis is this condition, okay? And Jimson weed, this is the type of plant, okay? And plants have this seeds. Now, earlier, children were eating these seeds, actually, and they were having hallucinations too, okay? Hallucinations. If somebody wants to have any hallucinations, there will be a Jimson weed, okay? You can people may take it and see flying hallucinations, like something like that, okay? But I do not advise to use this type of things because they are not allowed for us, actually. Now, another one. Let's move on here. Atropine effects in order of increasing dose are decreased secretions, salivary, bronchiolar, sweat, hot and dry, okay? Now, mostly, what type of effect do we see when the muscarinic receptor antagonists are being given to people, okay? So, and mostly in many different cases, if we make the one-word conclusion, what will be resulting? We can say as if we want to say everything with only one word, it will be the word dry, okay? Dry, okay? Everything will become dry. Now, in ice, and then there will be a decreased production of aqueous humor. It will become dry, okay? Another one in esophageal part of the nose is actually also becomes dry too. Another one, mouth will become also dry too. Because of what? Because the decreased production of the saliva. Another one, the GI tract, in the GI tract, there won't be any production of liquids. Like what type of liquids? Hydrochloric acid, for example, won't be, it will be produced, but only in smaller amounts. If the amount of it, this, now where did we go? Here we have, okay. Now, if the amount of them is given high, it will be completely stopped too. Another one, here we have mydriasis and cycloplegia. Okay, mydriasis and cycloplegia, good for eye exams, bad for elderly. This is the condition. Okay, good for eye exams. Now, why it is good? Because people become dilated, and they will be able to see better, because a higher amount of light is entering their eyes. Now, cycloplegia is also the condition. Now, there won't be functioning some muscles inside of the eye, okay? So what happens in there? They become what? And when they will not be able to see closer images in there, okay? Closer images will not be, and now if they do not take care of them later on too, they will be seeing what? Double images, for example. One eye will be looking to one direction, another eye will be looking to one direction, and now it will be having really difficulty too. People will not be able to concentrate on one thing, actually. Now, hyperthermia is actually very fatal too. Okay, fatal for what? For kids actually. What happens in there? If the sweating is being stopped, let's say, also vasodilation will be occurring too. If the sweating is stopped, what happens? The body temperature is going to be increased. Okay, if the body temperature is increasing, now kids, this will affect mostly in very small kids, infants, for example. By sweating, they release actually the amount of heat. Okay, but if they do not sweat, their temperature will become even 40. It can even reach to 41, 42 degrees Celsius, and these kids may die. Okay, and this is called as hyperthermia. Tachycardia is also will be treated too. For compensation will be occurring too. T and AV block will be occurring in there. Now, pharmacologic effects of these antagonists are, and they are used as sedatives. Okay, urinary retention and constipation may occur too. Behavioral excitation and hallucinations may also occur. We have talked about with what? With atropine. You may notice about it too. Now, and what about other classes of drugs with antimuscarinic pharmacology? Now we have the antihistamines, first generation. Later on, there is also the related chapter with the histamines too. Okay, we will be looking through them too. Try in TCA actually. This is not the tricarboxylic acid. Okay, this is the tricyclic antidepressants. This is the TCA, and now antidepressants, and they have also what? And another one, and then it's antipsychotics. Antipsychotics can also be used as muscarinic antagonists too. Okay, quinidine, another one. Amantadine, another one. Niperidine is also another drug as antagonist of muscarinic receptors too. What do? They do is actually they do mydriasis, tachycardia, dry mouth will be occurring in there. You may have noticed when people what they take inside these antidepressants, and they may also have this dry mouth condition too. Okay, and now you may ask some people, did they have this dry mouth condition too? Now another one, urinary retention also will be occurring in there. TX with bethanechol too. Okay, here replaced used together with bethanechol actually. Ganglion blocking agents. Here we have and nicotinic receptor antagonists. Okay, these are used for the nicotinic receptor antagonists. Now these are what do they do? They block the ganglion. Okay, and what this here we have two drugs actually, hexamethonium and mecamylamine. Okay, mecamylamine. And they do reduce the predominant autonomic tone too. They prevent baroreceptor reflex changes in heart rate. And another one, let's move on here. About the baroreceptor, we will be talking about it at the end of the class too. It is really important now when the blood pressure and now maintaining the certain blood pressure in our body. Okay, this is really important. For example, when people just directly get up, what happens? There will be a change in blood pressure occurring. In order to balance it, and there will be an activation of parasympathetic nervous system or sympathetic nervous system too. Okay, according to the condition of the blood pressure, it will one system is going to be activated. Okay, so one of them will be constriction will be occurring. Another one, dilation, also will be occurring. If another process will be occurring too. Okay, if the pressure is increased, one of them will be used. Okay, for example, if the blood pressure is increased, what needs to be done is vasodilation needs to be done. Okay, And now if the blood pressure has been decreased, and now vasoconstriction needs to be done. So there will be another two cycles are in there. It will be controlled by central nervous system. We will be coming to it after some time, okay? Now, bridge to physiology, autonomic nervous system dominance, okay? PANS, we have already talked about the PANS, and PANS are mostly dominant ones. These include SA and AV nodes of the heart, the pupil GI and GU muscles now, and sphincters too, okay? And what about this sympathetic autonomic nervous system? It is dominant only in terms of vascular tone and thermoregulatory sweat glands. We have talked about these two. And they are only these two are dominant in sympathetic autonomic nervous system, okay? Here we have arterioles. Now we have already talked about it. Now let's come to the last one. Okay, here we have the last part that I was talking about it. If the blood pressure has been increased, let's say, now here is a figure actually, which shows the homeostasis of blood pressure. Okay, keeping the blood pressure in a constant place. Okay, in a constant range. Okay, and now if there will be a really high decrease or really high increase, it will be going to be changed too. Okay, for example, let's say we have blood pressure decreased too much. Okay, and now there will be and the signal is going to be to the baroreceptors, and these baroreceptors send a signal to vasomotor center. From the vasomotor center, and there will be and it will be entering to central nervous system, which will be sending which signal needs to be activated. Let's say we have high blood pressure. Okay, high blood pressure needs to be decreased. Okay, and because of what? Because parasympathetic autonomic nervous system is going to be activated. Now, this parasympathetic autonomic nervous response is going to decrease the heart rate. Okay, heart rate is going to be decreased in that way, and the blood pressure is going also to be decreased too. Okay, but what about if the opposite version will be occurring in there? If the blood pressure is going to be decreased, and in the signal will be also going to baroreceptors, vasomotor center, and then to the central nervous system, and SAS is going to be activated. So heart needs to be beaten even more in order to increase the blood pressure. Vasoconstrictor also is going in a similar way. Ganglionic blocking drugs do not prevent changes in heart rate elicited directly by the drug, okay, beta-1 or M2 agonists. And ganglion blocking drugs prevent reflex changes in heart rate elicited by vasoconstriction. This is the alpha-1 receptors. Alpha-1 receptors we have already talked in adrenergic pharmacology class 2, okay, in previous classes too. And vasodilation also, which is related with what? Beta-2 receptors too, okay. This was the algorithm reflex. Now, actually, this was the last part, but what I wanted to say is also one more thing, okay. I want to talk about the dumbbells, okay? And do you know about what is the dumbbells? Now, here we have, okay, toxicity of acetylcholine inhibitors. What does it mean here? If the people take too much higher amount of these acetylcholinesterase inhibitors, it can be affecting. It can be resulting in certain types of effects. Okay. And now, for example, in the muscarinic ones, it will be having different effects. These effects for the nicotinic ones, it will be having these effects. Okay. So for the muscarinic ones, how can we know that there will be what type of changes will be occurring in there? Diarrhea will be occurring. Okay. Because of what? And diarrhea is located in what type of area of the body? And it's in GI tract. And the last part, there will be an increased amount of glands start to release more liquid in there. So there will be a diarrhea occurring, okay? What about the urination? Urination is also related with muscarinic receptors. Muscarinic receptors, which they are located in bladder, okay, urinary bladder too. And what about meiosis? Meiosis, and they are also located in now in eye, for example, in eye there will be a meiosis occurring. Now, what type of receptors are also in there? There are also M3 receptors, okay, bradycardia, for example. Now, bradycardia, and there is, and this is the now also will be affecting the muscarinic receptors. But here, this is the difference, okay? It's not the M3 receptor. This here we have M2 receptors, okay? M2 receptors are going to be activated and stimulated really in an increased amount, okay? Bronchoconstriction is also the related thing. There is also the what M3 receptors in there. Lacrimation related with the M3 receptors. Salivation related with M3 receptors. Sweating too. But what about the central nervous system stimulation? Here, this is it is related with emesis. Emesis, okay. Emesis is the condition when people want to what? Vomit, okay, vomiting condition. They want to vomit, okay. When the central nervous system has been highly stimulated, they the people may want to vomit too, okay. And this is here we have the M1 receptors, okay. It's not M3, it's not M2. Most of them are actually used for found in what? And they all have mostly M3 receptors, except these, okay? Bradycardia has M2 receptors, and central nervous system has what? M1 receptors. You can memorize it in this way. Okay? But what about the nicotinic effects? Nicotinic effects, and now these are the skeletal muscle agitation followed by paralysis, okay? This is very dangerous condition too. By what? And now, when let's say there is a diaphragm will be paralyzed, what happens? People will not be able to breathe. Okay, this is really very dangerous condition actually. If the people will not be able to breathe, they will be dying. Okay, this condition is now fatal actually. Central nervous system is also going to be stimulated in here because nicotinic receptors are found in what? And they are separated into two parts. And M and sub M is activated in here, but N sub N is going to be activated in here, okay, in the central nervous system. N stands for the neurons, M stands for the muscles, as we have talked earlier too, okay. Management, how can we manage this toxic condition of of acetylcholinesterase inhibitors? We will be doing what? Muscarinic effects. We need to use atropine. Okay, atropine is antagonist of muscarinic and nicotinic ones. Now this is for muscarinic ones actually. Now the generation of acetylcholinesterase is prelidoxim 2-PAM, okay? And another name for the prelidoxim is 2-PAM actually. And now, how does it convert? How does it actually regenerate the acetylcholinesterase? It will be, now let's see it. This is the condition, okay? This is our acetylcholinesterase. It is bound actually to what? It is bound to our substance, our, let's say, receptor. This is the receptor, okay? Receptor, and this is the phosphate group, and it is bound to acetylcholinesterase. So if there is no usage of 2-PAM or prelidoxim, it is going to be converted to aging period. Okay, after aging, it cannot be converted to, it cannot be regenerated in this way. Okay, but if it will be used on time and after just blockade, after the blockade only, directly, if it will be given this prelidoxim or 2-PAM substance, it is going to be regenerated. Okay, because of what? It is going to be separated into two different parts. Now, acetylcholinesterase and this substance is going to be formed. Okay, phosphate group is going to be attached to 2-PAM, and acetylcholinesterase is going to be released in that condition. You can keep it in your mind too. This was the important part of these toxic conditions related with acetylcholinesterase inhibitors. Okay. Now, actually, this was the end of our class, everybody. I hope this was useful for you. If there will be unclear questions, everybody feel free to contact with me. You have my WhatsApp number. All the leaders have my WhatsApp numbers. And now, okay, guys, you can write to me too and share with your thoughts about today's class too. I hope you'll be listening it till now and having what really useful information from this lecture too. Okay, everybody starts continue studying for the pharmacology. I find it really interesting. I have never actually taught pharmacology before, but this is really nice and challenging to me too. I like when people learn new things. For example, I also learn new things. I also teach you also new things too. This is very nice to know. Okay, if you develop this type of skills too, and develop studying skills, for example, it will be really helpful for you, especially for the students, for the medical students. Okay, and now. Okay, and now let's enter our lecture. Everybody, take care of yourself. Okay, see you the next time. Okay, bye.